Hi, this is Erin Alberty. I'm a reporter with the Salt Lake Tribune, and this is Trib Talk. We are about halfway through an emergency order requiring masks statewide as a result of the coronavirus pandemic and also limiting gatherings. We find that hospitals are getting more crowded. Thanksgiving is right around the corner, so we've got a lot to talk about. And with me today, I have Dr. Eddie Stenehjem. He's an infectious disease physician at Intermountain. And so I guess, Dr. Stenehjem, thank you so much for joining us today.
You're welcome.
All right, so I guess let's start with kind of talking a little bit about Governor Herbert's order. It requires masks in public, but I guess not at churches and not while eating at restaurants. It bans gatherings with people outside of your own household, but it still allows people to gather in businesses. It suspends some school activities, but not others. A lot of rules. Quite a few exceptions to those rules too. So first of all, looking at masks, most of the state was already under a mask order when the new rules began. And a lot of our hardest hit counties have been under mask orders for weeks or even months before the state required it. So, we've been told exhaustively that masking is important, but cases are still rising a lot. So why isn't it working, I guess? Because I think people are starting to feel like it doesn't matter because so many cases going on.
Yeah, I mean, I think the governor coming out now about 7 days ago was great in the fact that it simplified the message. As we had transmission indexes, we had counties coming on and off, and that kind of was based on masking or not. And so essentially the message that the governor has said is like, listen, all of Utah is in high transmission, period. We all need to be masking when we leave the house. No questions asked. Doesn't matter what your transmission index is. We just all need to do it. But you're right. About 90% of the state was already under a mask mandate based on the transmission index. And so the majority of the state was under a mask mandate. This just clarifies it, makes it simple. And we know that going forward, we're going to need to do it. But Erin, your point is it going to be enough? And it's one thing to have a mask mandate. It's another thing to have people wear masks. And so this is all about community engagement. We know that masks work. The science behind masks is clear. This isn't up for debate anymore. Masks are the safest, cheapest, easiest intervention you can do. We know that they reduce transmission from an infected person in an environment. We also know that they're also protective for the person wearing them. So the science is clear. It's just getting people to wear masks. And, I think it gets into kind of where are we seeing transmission, right? We're seeing transmission in people's homes where they don't typically wear masks. And so people are getting this infection in the community, coming home, bringing it home, transmitting it, amplifying that transmission in the home. And then as you bring in people into your home for social events, family events, you have these big spreading events, which then leads to more and more transmission in the community. And so you can't do just one intervention. Masking by itself is not going to solve this. It has to be part of a really multifaceted public health approach.
I know that there were a series of kind of graphic illustrations of the spread of coronavirus and the aerosol cloud that transmits it, and it was in El País. Have you seen this?
Mm-hmm. Yep.
It was shared around by a lot of public health people. Yeah. Did you find that to be an apt representation of what happens? Because it does show, especially in like family gatherings in a living room, that even the people were masked, like 5 out of 6 ended up contracting it in their model.
Yeah, so I mean, it's a little challenging to look at some of those things, specifically in home transmission, where mask use is not 100%. There's not 100% compliance. There's people eating in the home, which we know is a perfect time to transmit the virus because you can't wear a mask when you're eating. And so some of those kind of in-home transmission models are really challenging because, what does mask compliance look like in the home? And so I think it's more important for the public to know that in-home transmission is incredibly common. And as you invite people into your home, take Thanksgiving, for example, that's an incredible opportunity for a transmission event. Windows are shut, people are in a tight area, they're talking, they're eating. This is a perfect area to transmit the virus.
Now, I know that for the past week and a half or so, well, since the executive order went into effect, there has been, a rule banning gatherings with people outside of the household. It's been a week only or so.
Mhm.
Are we seeing any difference in transmission in small gatherings?
Right. So we're probably not going to have a sense of whether or not these new, mandates put in by the governor is having any effect until later to the end of this week, unfortunately. And so we know that the incubation period of the virus is it's right around 5 to 7 days, up to 14 days. And so if we had immediate changes in people's behavior, let's say starting last Monday, 7 days ago, we really aren't going to see any effect on our case counts until probably the earliest mid to late of this week. And so we're really going to be looking closely at the numbers kind of towards the end of the week to say, did this have any impact? And by the weekend, we should be seeing some changes if behaviors change due to the governor's message last Sunday.
But that's when the order expires.
Exactly. So
They
that
need more time?
right. So we think about cases as kind of leading and lagging measures. So what it's going to influence first. Well, first you have a mandate that influences behavior. Hard to measure behavior, right? It's hard to get out and measure and put a number on, have people actually stop doing in-home gatherings. And so your indicator that comes next is your cases. And so really aren't going to see that start downtrending until the end of this week. And then after that is hospitalization. So we know hospitalizations are going to continue to rise for the next 7 to 14 days, starting from today, even if transmission were to stop just altogether, which we know it's not.
Right.
And so, what the hope was, and unfortunately, you're not going to have data on this by the time that this 2-week period ends, is that the hope is that you're going to really reduce the number of cases. And that's going to get down to a point where you have lower community transmission, which then eventually is going to offload the hospitals. But that is 100% contingent on behavioral change in the community. And so we don't have data on that, right? And so what's challenging is that 2 weeks is the smallest amount of time you can put in a pause, but we're not going to see the effect of it probably until at the end of next week, or the end of this week, or early next week.
So it sounds like the order kind of came in too late to provide any useful information by Thanksgiving.
I think it's going to be hard for us to interpret the impact of the order prior to it being discontinued.
Right. So, and it is being discontinued right before a major holiday with lots of indoor eating and contact with other people. So I don't know that we have gotten guidance from the state about Thanksgiving. Just from a medical perspective, what is your recommendation?
So our recommendation that we are, promoting across Intermountain is that do not gather in large family gatherings. It's that simple. We know that if you bring people together in a home, that you will have augmented transmission, period. The amount of COVID-19 cases that we have in the state of Utah is so high right now. If you look at our test positivity rate, if you look at any of these metrics, the amount of community SARS-CoV-2 is incredibly high. So if we are bringing people together, we will have increased transmission, and that will lead to increased hospitalizations, which is not something we can, manage right now. And so our recommendation is to have a family gathering with the people that live under your roof. It's that, unfortunately, it's that easy, but it's really hard to implement because Thanksgiving is a holiday we'd love to gather with friends and family for. But this year is unfortunately a year we're not going to be able to do that safely. And especially if you're having people with at-risk populations in your house, older people with, compromising conditions, you're putting them at risk if you're having gatherings.
Do you think Utahns will heed this advice?
I hope so. I really hope that they take a look at what's happening in our hospitals. I mean, Intermountain ICUs, 94% full, which some people not hearing that probably, okay, I don't know really what that means, but what that means is we're getting to a point where, you know, if people are coming in with a heart attack or with a stroke or with a trauma, we don't have the beds and the caregivers to take care of them. And so the implications are really vast in terms of what this means to the health of the public. And we sure hope that we can provide the care people need. But if we continue on this trend, we're going to outstrip our resources in terms of caregivers and also physical space.
Now, I know at Thanksgiving, I mean, this is Utah, so we've got a lot of people whose traditions involve pretty massive family gatherings. I mean, like 80 people. I've heard about the potato counts for some of these events, but we also have a lot of people who maybe will choose a more middle of the road option, or what seems to them like a middle of the road option. And I'm guessing that there are probably a lot of our readers who think, well, for the past 2 weeks and before that, I have been really careful. I've gone beyond the governor's order. I haven't really seen anybody. I haven't gone to a restaurant, I haven't done anything. And the people I want to see for Thanksgiving, it's just a few people, and they all say they've been safe too. Meanwhile, like, I'm looking around and seeing a whole state full of people going to restaurants and bars and churches, and they may or may not be wearing masks for that. And they're going to go right back to doing all of that after they meet with, 25 other people on Thanksgiving. So if the hospitals suck in December, people are going to say, well, that's probably not going to be my fault because I had one meal with a couple other people.
Right.
Are there degrees of risk to even entertain right now? Or, in the big picture, or should, because I don't know if everybody believes that the benefit and the risk reduction of a very small gathering is worth the sacrifice of another holiday, especially when people are lonely after 2 weeks of lockdown.
Right. So, we put on artificial numbers, right? Of like, oh, don't gather in groups of 10 or more. Or,
right.
These are artificial numbers. You absolutely can still have transmission of COVID-19 in a group of 8 people, of 7 people, 2 people, 100%. Yeah. And so the safest thing you can do is not gathering, right? And so, yeah, there are obviously, a spectrum of risk that gathering of 80 people in, in a basement, and those 80 people haven't taken any precautions, that is a much higher risk than a small gathering of people that have been very, very diligent in terms of their public health measures. There's lots of people doing amazing things. So I don't want to discredit. There's a lot of Utahns that are doing this right, and they are socially distanced. They're always wearing a mask. They're not going out. They're working from home. They're not sending their kids to school when they're sick. And so there's lots and lots of people doing the right thing. The challenge is that not everybody is, and public health requires everybody to do the right thing. And so, there are people that say, oh, I'm going to take, 2 weeks in quarantine, which is going to essentially reduce my risk of having COVID-19 by the time I get together with people 2 weeks later to very low, right? Mm-hmm. And so that's great. Your risk of bringing COVID-19 to that group may be very, very low, which is a benefit to the people that you're meeting with. But if not everybody in that group is doing the same thing you're doing, and if you have one person who's dining in at a restaurant, who's going to a gym without a mask, or going to a church service without a mask, and they bring in COVID-19, well, it doesn't matter what your risk was. You're now at risk to getting infected. And so it all depends on how people interpret their risk. I don't know how many times I've talked to patients with COVID-19 and they say, I have no idea how I got this. But then when you push them on it and you say, well, what do you do for work? Well, I work in our office. Do you wear a mask in the office? Well, no, we don't wear masks in the office. And then you say, well, that's where you got this. So people's interpretation of their risk is very different. And you really have to understand what is that risk that everybody brings to a small gathering to really understand what truly is your risk of potential transmission.
It reminds, when I was in high school, I was in a show choir, and I remember one of the students was just watching to see if we were doing the dancing and singing right. And at one point she said, "I think you think you're smiling."
Right.
And it's like, but then it's like, you really aren't. If you saw your own faces, you would realize and think that a lot of people think that they are probably doing everything right. And I'm wondering, and tell me what you think about this. A lot of what we see about, a lot of I'm part of this too. A lot of media coverage of coronavirus that we've seen kind of from the beginning, we do see a sort of an amplification of a pretty extreme point of view. And we hear a lot from like the COVID truthers, but perhaps and that gives us like the foil or whatever of like, well, at least I believe in coronavirus, so I'm probably doing everything, like I'm one of the safe ones. The people who are storming a hospital aren't. Is that, I guess, affecting people's overconfidence in their own behavior? Uh-oh, I think we've lost Dr. Stenehjem. Let's see. I'm going to see if I can find him here. We will wait for him to reconnect. Our web host says we will wait for a minute. And if he doesn't come back, I'll bid you farewell. Hopefully we can pick up this conversation again soon. Here we are. Excellent. I see you. Can you see us?
Yeah, I'm not sure what happened there. I could see you, and can you hear me okay?
Oh, yeah, we can hear you. Sounds good.
Yeah, I mean, your question is a good one of, are people underestimating the risk just based on the fact that they, understand the science of COVID-19 and
people who are rejecting that.
Right. I mean, there's lots of camps, right? And I think what you do see highlighted in some media reports is the people that are the truthers or that don't believe in this. I think that's the minority, right? Mm-hmm. And we've tried to educate them, and I take some personal, ownership of this, and maybe we've been unsuccessful to educate them. And we've tried to show them the hospital and the impacts it has on patients and the long-term impacts of COVID-19 and how this destroys families and it kills people. And we've shown them everything we can. And, I don't think we're convincing them. And,
right.
Quite frankly, at this point, I'm not sure what to do for that. And I think it's really focusing on the people that, understand that this is a public health emergency that none of us have ever experienced before. I mean, this is as bad as the 1918 pandemic, right? And nobody's ever gone through this before. And I think focusing on those people to understand, like, thank you for doing everything you are doing. Thank you for wearing a mask all the time. But some of the activities that you do pose a risk. Indoor dining poses a risk. Gathering with friends outside of your house that live outside your house poses a risk. And really being able to highlight that, yeah, some of these things that you're doing that you think are safe truly can lead to transmission.
Yeah. Do you think that the fact that the most recent order, which may be a signal to people that things are worse, but it still leaves so many venues for transmission open, like restaurants, bars, churches, gyms, etc. Is it inevitable that we're going to have to close that if we're going to ever get a handle on this before whatever distant date a vaccine arrives?
Right. I do think that if we continue on the same trajectory, that there will need to be more restrictive measures put into place. And that are, some of the things you highlighted, closing indoor dining, closing bars, potentially having high schools go online, maintaining elementary schools in person. These are things that if we don't see a change soon, meaning this coming next 7 to 10 days, I think those things are potentially inevitable because a vaccine is not going to be available for the general public for months. I mean, it's great news in terms of what we've seen in the from Moderna and Pfizer, but it's not going to get us out of this surge that we're currently in.
No, I mean, it seems like this is kind of in it for the long haul. And, I guess to our earlier discussion, we had, 3,900 people on a single day last week. I mean, yeah. 3,900 people weren't protesting at the state epidemiologist's family home, right? Like, there's a lot of people who probably thought they were doing everything right in that number. Have you encountered a lot of patients that really thought that do they feel kind of betrayed that they thought they did everything right? And then it's like,
right. No, we definitely see that. We definitely see people think that, oh, I've done everything right and I still got this. I'm in the ICU, I'm on a ventilator. And it's unfair, right? It is unfair that, people can be doing the right things and they make one mistake and they can get infected. The virus doesn't care if you wore a mask 99.9% of the time. It doesn't care if it just happens to be there for the 0.1% of time that you're not being careful. And so it is hard that these people, are doing a lot of good things and are still getting infected. And it shows just how sinister this virus is, how contagious this virus is in terms of how well it can transmit, workplaces, environment. It's just terrible.
No, it seems, and you mentioned this, that you hope that one of the things that people internalize before Thanksgiving and before they potentially make the decision to meet with people is just how rough things are going in the hospital. And I was just in following social media. Even in places like I think Belgium recently had some experience that when people really, believed that their access to healthcare or the quality of the care they would receive is deteriorating, that was more likely to change people's behavior. And I'll be frank, I'm not sure that we have actually gotten a ton of transparency on that over here. I know that we've heard a lot of healthcare workers describe being stressed and tired, but we also aren't getting bed numbers from the hospitals. We don't know what the total number is. We don't know how many are. We don't even get a daily update what percentage of the beds are taken by COVID patients. I know I'm parsing the dashboard every day, but people who think if they get sick, they're going to go to, say, Dixie Regional or to, say, Timpanogos Hospital in Orem, they don't know how many beds are free in that hospital. They don't know how far they might be transferred away or if their insurance will be, if that'll be an in-network thing once it happens. We're not really hearing about that. And, we keep instead getting warnings about something that will happen at some undefined future point. And every time a doctor comes to a press conference and is choking back tears, we also hear somebody else say something triumphant like, well, we're probably meeting the challenge. We'll keep doing whatever it takes. I'm not sure people think that it's as urgent as maybe as you are saying that it is. So if I go to Intermountain, where you work, COVID, for a car accident, for a heart attack, for anything, am I going to be alarmed by what I see there? Am I going to be like, I've sat here for 4 hours in bed and I haven't seen anybody and I'm fainting and I don't know what's going on?
Yeah, so lots of great comments there, and we'll kind of maybe talk about a few of those.
Sorry, I kind of went off there. Man.
Some of the challenges we've run into is that when we talk about numbers, that doesn't mean anything to anybody. If I told you that right now Intermountain Medical Center has 87 COVID patients, that doesn't mean anything to a person that's doesn't work in healthcare, doesn't work in the hospital. It may not mean anything to primary care providers who aren't taking care of hospitalized patients. And so putting distinct numbers on some of these kind of loses its context, where if I heard that, I'd be like, holy cow, are you kidding me? Like, this is incredible. Here's a 460 bed hospital and you've got over 20% for one single condition. Like, that's just.
Is that unheard of? To have 20% of your.
Absolutely unheard of, right?
Okay. We don't do that.
Right.
That's
so
thank you.
These are the numbers that, it loses its context for most people because it doesn't sound, we're not saying there's 3,000 people in the hospital, which is this, number that sounds really big. So it is, hard to relay that in a quantitative measure to people that don't really understand, well, what's normal? Like, well, how outside of the realm is this? I can tell you, that having this many patients for one single condition take up over 2 full ICUs is just unheard of. You never see that for like influenza. Worst influenza season, you might see 5 to 10 people in the whole hospital, in the ICU for influenza. Here you've got 2 very full and, to the limit, and we're developing new ICUs that are just for COVID patients. Like that phenomenon has never happened for us in this current, healthcare, environment. That's just fascinating. And so it's a little bit challenging for us to be able to convey that message. And so I think that's the reason why you're seeing healthcare systems not necessarily reporting those specifics, but reporting a percentage of how full their ICUs are. The other challenge is that, Intermountain, we're opening up ICUs in places that haven't had ICUs before.
The denominator is changing.
Yeah. And so now what's happening is like, if you look just at our standard ICUs that we have had at Intermountain, they're all full, 100% full. But now we have a new ICU opened up on a cardiology floor that there wasn't an ICU there before. We've increased the ICU capacity at LDS Hospital from 14 to 20 beds. We've developed a new ICU down in St. George in the post OR suite, which has never been there before. So it's really challenging in terms of the denominator. Like, are you talking about your standard ICUs? Well, the standard ICUs are full, like, period. Like, we're now talking about extended access ICUs. And so the care is different. I mean,
how is the care changed?
Yeah.
Like, I can't imagine we can just go on like this without it suffering at some point.
No, the care has absolutely changed. So one, you're taking care of patients in an environment that you've never cared for them before. Okay, so things are different, just that. 2 is as you open up more ICUs, you can't have the same amount of physicians and nurses and support staff to care for them. You have to increase the amount of staff to care for them. Those people that care for them are different than the people that care for standard medical, patients that are on low flow oxygen, those things. And so now you're having us bring in nurse practitioners, PAs, to redeploy into the ICU that are supervised by an ICU physician. We have nurses. We're hiring 200 nurses that have never worked with Intermountain Medical Center, Intermountain Healthcare before. Now we're asking them to say, take care of these most complex patients that you've had in a healthcare environment that you've never been in. We're bringing nurses in from the floor. And so the healthcare is changing, and it's changing because we're just getting overrun by patients, and we're having to ask providers to do things that they aren't comfortable with. And so you'll see that. And it's hard when you say, if I were to come to your hospital, would I notice anything different? So we have one entire floor on at Intermountain Medical Center, and that whole floor is just COVID patients that are sick enough to be in the hospital, but not sick enough to be in the ICU. And you go walk on that floor, and what you're struck by is the fact it's so quiet. Okay, which is something you would get on the floor, you're like, this seems fine. But it's so quiet because all the doors are shut. There's no family, there's no visitors, and everybody's in their room because they're not allowed to walk around. They don't have any families to talk to. Everybody's in PAPRs and in N95 masks, and it's eerily quiet. And so it is not a dramatic scene, right? It's a sad scene. Yeah. It is really sad because you know that in every room, and there's 33 rooms on that floor, is somebody suffering from COVID-19. And they're doing it by themselves, and they're scared, and they don't know if they're going to get sick enough to have to go to the ICU. They don't know if they're going to get better and go home. It's really depressing and sad.
Yeah, I think that, what you were saying about people with all of these improvised solutions, people being forced to kind of break routines and stuff. I'm not sure, and maybe that's kind of for our last kind of point here, if you could explain to viewers, I guess, why that matter. I guess how much of doing healthcare without making mistakes depends on sticking to routine, and how much do those disruptions, I guess, open up little land, or, open up holes in the ground for, like, I was used to doing it this other way, and now, oh my God, I made the mistake I thought I'd never made.
I mean, healthcare is so complex. I mean, you look at, people compare this to, flying a plane. That's not a fair comparison. We know how a plane works. We know everything about that plane. We know about physics. We know how that plane works. The human body is so complex, and this virus affects people so differently and affects every single organ, and it's brand new, and we're just learning about it, and it's 10 months old, right? And so the margin of error is really low. And so now you get people that are coming in that aren't used to taking care of these complex sick patients, and you put them in a complex environment. Healthcare just by itself is incredibly complex. You're potentially, going to have more errors. You're going to potentially not have as good of care that you would have if you would have had the ICU team that we have in our respiratory ICU, shock trauma ICU, neuro ICU, that works together as a team. They know each other. They know their first names. They know, what their daughters do. And, they are a cohesive unit that work together every day. That's the team I want taking care of me.
Yeah. Yeah. Well,
the team I want in my parents. And, now you're talking about new nurses, new physicians, new PAs, new nurse practitioners, and you get this complex environment. It's different. It's just different care.
Yeah. Well, I sure hope that sometime soon we can get your teams back to their normal places and optimize what we've got. I know that this has been the Dickens, and I really appreciate you taking some frank questions and just giving us some honest answers here. I think that it's just, it's been a hard topic, I think, for a lot of the public to kind of pick out what to remember. and
right.
it's affecting the behaviors, even, I think, of very well-meaning people. So
right.
Hopefully we can continue to gain clarity on this. And I just really, really appreciate you taking the time.
Of course. Thanks, Erin. Appreciate it.
Awesome. Thank you. I'll be talking to you again soon, I'm sure.
I'm sure.
All righty. Bye. Bye-bye.